There's a lot of things to think about when you're returning to physical activity in the postpartum period. You want to think about the type of delivery that you had. If you had a completely uncomplicated vaginal delivery with minimal or no tearing, you can pretty much start physical activity and exercise almost right away, or at least as soon as bleeding has stopped. In contrast, if you had a more traumatic birth where you had significant tearing or you had a cesarean section, we do recommend taking a little bit more time to heal and recover so that those tissues are healing appropriately. Other things to think about are if you are experiencing things like anemia, so low iron during pregnancy, this can persist into the postpartum period. If you had significant bleeding, so postpartum hemorrhage, this can also put you at increased risk of having anemia. If you have anemia in the postpartum period, this can really contribute to excessive fatigue. And so getting those iron levels back up, getting them checked and then back up is going to be really important as you return to physical activity. So when you do start physical activity again in the postpartum period, you want to think about it. We don't want to think about pregnancy and delivery as an injury, but in many ways we are thinking about it in the same way, in that you need to rehabilitate your body so that you can get back to your pre-pregnancy activity levels or even potentially higher. So when you're restarting, you want to start off nice and slow. Start at low levels and gradually build your activity, increase your volume, increase your intensity. But this progression is going to be based on the symptoms that you're experiencing. So for example, if you start to increase the duration of the walking that you're doing from 5 minutes to 10 to 20 to 30 minutes, and you're not experiencing any increases in pain, excessive levels of fatigue after your activities, and you're not experiencing significant increases in leakage, so urinary incontinence with those activities, then you're fine to continue to progress. But if you experience an increase in symptoms, so increased pain, increased urinary incontinence, then you probably just want to take it back a little bit, certainly get it screened and checked by a healthcare provider. But work at those, don't progress too quickly until those symptoms have alleviated. For a very long time, we know that people thought that they couldn't or shouldn't return to sport in the postpartum period. And there's data that suggests that becoming a mother is often the reason that people stop sport in their reproductive years. However, we find that many people strongly identify with themselves being an athlete, and that being active in their sport of choice is actually improving their overall health and well-being. And so we're now starting to recommend that if you were engaging in a sport before you were pregnant, even during your pregnancy, that we strongly encourage that you continue or you resume it in the postpartum period as well. It's a significant life change. You're taking care of this little new life. You're probably going to experience some level of sleep deprivation. You might be feeling tired or a little bit grumpy. It's really important that you take the chance to engage in self-care. Take time out of your day to engage in physical activity. Go to a class, see other moms, go and speak to other people and engage in other parts of your life again. Self-care will help you to improve your overall health and well-being in the postpartum period.